Teeth and gums. Tooth. I'm a little bit late to the party in terms of oral hygiene and flossing, I admit. It was something that I knew I should do. My dentist or my hygienist would always say I should do, but I hadn't engaged. I wasn't in the habit of going regularly. I only went to the dentist when I had a problem. It didn't click. And then I went to a new dentist in Kenmare. He's called Con O'Leary. He said, your teeth are pretty okay, but your gums are in a total, they're just a disgrace and you've not been taking care of them. And then he said, as a dentist, my job is to educate you how to take care of your gums so that you don't need fillings. And that is the first time anyone had ever said that to me. And I thought, wow, this is a completely different approach. I am now flossing every night. I'm using the little TP brushes, seeing him every 3 to 4 months just to really keep on top of it. I've lost all the little black marks on my teeth. My breath doesn't smell anymore, which is amazing. I feel confident about my teeth, which they're kind of a little bit crossed, so whatever. But I don't care about that. I just feel confident because I'm taking care of them and I've established a habit now. It takes a little bit I thought, oh yeah, I've got to do that again, but it's so quick. I just brought these two things up. I use this silk floss. It's a silk with beeswax. And what I love is that it's refillable. So it's in a little plastic container, but you can get the refill, which is 2 lots, 25 meters of floss, 50 in total, and you can just pop them in, you just exchange them. In terms of toothpaste, I'm using the Dimples hydroxyapatite toothpaste, which is a fluoride alternative. There's a lot of concerns about fluoride, obviously, and lots of different health implications, but hydroxyapatite is non-toxic. This is not the nano size particles. This is a normal particle size. They've put some xylitol in there as well, which helps to reduce gum like bacteria and plaque. Menthol, and it's safe for children, safe if you happen to swallow it. And hydroxyapatite is a remineralizing agent. So it's what your teeth are made of, and it just helps to fill in little gaps. The main thing that I hadn't realized about flossing is, so you're going between each tooth, you're not sawing backwards and forwards. You're going to damage your gums, but you're slipping the floss up underneath, right as high as you can, under the kind of lip of your gums. And so you do that one side and then you do the other side, and then you do one side and you do the other side. And there's none of this going on. Under the gums is where you're really trying to remove it from. You angle the brush so that it gets up underneath the very top of your tooth, which sounds painful, but if you have a soft brush, it's okay. And you just do it very carefully. And so it's the angle of the bristles to get underneath there. I had never properly realized that. So I would suggest looking up a video on how to floss properly, but I just think the clear explanation just totally changed the way I think about it all.